All right. José Torres, how we doing, brother?
Pretty good. How about you, my man?
I'm doing good, man. I'm doing good. Thank you for coming on. I really appreciate your time. I know you're busy. Like you were telling me before we even jumped onto this that you were working today. So I appreciate you taking out from your Saturday to come have this conversation with me. But I think it's an important one, right? So your name, you're Dr. Jose Torre, right? Rehabilitation and coach. Your Instagram is Movement Rehab Doc. You're a certified functional strength coach, and you're also a university professor, right?
Yes.
Does that sound about right?
Yeah, I'm a chiropractor. I graduated about 2021. So
Okay.
3 years being a chiropractor. Also strength function coach, like you mentioned, college professor in chiropractic college over here in Puerto Rico. So been doing that for the past year or so. So yeah, trying to
That's awesome,
cover
man.
different areas.
That sounds great. And it's pretty cool because as we were speaking before this, that you kind of have all these realms of knowledge and you can incorporate that to your clients, right? So why don't you give me a little bit about yourself, your background, and how and why you got into this space? I'm really interested in the why when it comes to these type of conversations, because I think that drives motivation and kind of passion as well.
Yeah, 100%. Yeah, I started doing Tae Kwon Do since 6 years old. So I've been involved like my whole life with martial arts.
Oh, nice.
Like every martial artist, like suffer a lot of injuries growing up and playing sports. Biggest one was the ACL. Was
Mm,
2017, I think. The year prior to applying chiropractic college, I tore my ACL, left knee completely torn, like weeks before the competition, biggest
like
competition in Puerto Rico.
a taekwondo competition?
Yeah, yeah, it was
Oh,
the week
Jesus.
before during practice. So yeah, like blew my knee out, like again, suffered a lot of injuries, but that was the cascade, the straw that broke the camel back.
Yeah.
Rehab was terrible. Uh, you know how it goes.
Oh, so
Most for
your
like,
experience in rehab was bad?
yes, that's what I like. I promised myself to be something different because my experience like with rehab was horrible. It was just
Right.
low level exercise, which are not bad right out of surgery, but like for like 3 months nonstop. It was just like light bands, light exercise, which did not prepare me at all to come back to sports. And after
Okay.
like 3, 4 months, like, yeah, you're ready to do your sports. And like, no, I'm nowhere near what I want to be or where I should be. So yeah, I promised myself like to be something different and just provide athletes hope because which was something they didn't do. It's like you're broken, cannot do the sport, like you will never be able to practice martial arts again in your life. And it felt so horrible. So it's like I don't want any other athlete to go through this like it did. So yeah.
Yeah, man. That's interesting that you say that because I also grew up in Puerto Rico. My brother had a really bad injury, and they told him
Hmm.
like, yeah, he's never gonna walk again. He's not gonna be able to walk. He's walking now. He's great. He's fine. But like, you get those horror stories when it
Hmm.
comes to rehabilitation, and I don't know if that's well, maybe you can tell me if that's something kind of just to cover their asses to be like, let's give them the worst case scenario,
Hmm.
or if it's something that you think it's a real diagnostic that they get to.
Like everything is like you can argue a mix of both. Like yes, they want to cover their asses, but also like they don't have the knowledge or tools. Like I don't want to say they don't care, but they don't have the tools and knowledge to like actually take it from point A to point B. And granted, like
Mm,
most people don't focus in sports, even less in martial arts or combat sports, which the demand and place in the body is going to be even higher. So it's like
right.
lack of understanding, like what the body's capable of, like what your sports require you from. Like, no, you want to be able to like, if somebody looks at jiu-jitsu, like it's tough on the body. Like, oh, you
Right.
cannot do that again. Like you're broken. You cannot do this. It's like, hey, you can. It's going to take some time and work, but you can. So I think it's a
That's
mixture
such
of
a good point,
ignorance
man.
and knowledge.
That's such a good point. Like a lot of these rehab, would you say a lot of these rehabs, not to, talk bad about
Hmm.
anybody, but would you say that a lot of these rehabs make these diagnostics or these diagnoses because they don't have an athletic understanding or firsthand
Hmm.
athletic understanding of the sport that they're trying to diagnose?
Big
Yeah.
time. So yeah, I think
Well,
my
that's
opinion,
good, man.
that's a mixture.
That's good that that's your kind of your you have that background in Taekwondo. So you came up doing Taekwondo in Puerto Rico. You had a major competition on the island in 2018 is what you said?
17. Yeah.
17. So 2017, you got injured, what, weeks before?
Yeah,
You tore
weeks,
your
it
ACL,
was,
right?
yeah, weeks before the biggest competition, I don't know if you have heard of it, but
Which
yeah,
one
like
was it? I'm sorry.
LILAI, Liga Interuniversitaria Atlética
Oh,
Futsal,
yeah,
yeah.
yeah, 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 yeah,
So
yeah,
yeah,
yeah, yeah. Okay.
it was 2 weeks, I
Oh,
think
damn.
2 or 3 weeks before it. So yeah, I was bummed.
So you were competing for the school, right? For a school?
Yeah, Calle, UPR Calle.
Dude, that's awesome.
Yeah.
That's awesome.
So
I kind
yeah.
of I like how Puerto Rico has that that kind of university level Tae Kwon Do. I
Mm.
think they even do judo too. Like they have
Yeah,
this university level competition for combat sports. I love that, and it's followed, dude. It's something that's pretty big over there. That's
and
pretty
even
awesome.
wrestling.
And they have wrestling too.
Yeah, I think last week or I think even last week. Yeah, last week was the like final or the competition for the wrestling team. Like it was over here in the west side. So yeah, they have wrestling. It's pretty good too.
Yeah, I know that Puerto Rico has get some really
Yeah.
good wrestlers. We got one that had a silver last year in the Olympics, which was pretty cool.
Yes. Yes. I forgot his name. He's lighter
Me
weight,
too.
but yeah, he's pretty good.
Right, right. So you got injured. At that point, were you already studying to be, to work in rehabilitation?
Not so much. I was planning on doing medicine, and
Okay.
I always loved the human body and exercise and being active. I wanted to like
Right,
do like physical medicine rehab, PMR, like doing a physiatrist and all that.
right.
Again, I want to talk down on any profession. I didn't like the approach that much. I wanted to be like get down and dirty, like roll my sleeve and like being with the patient, doing with the exercise, but
Mm,
also be a doctor. And I
right.
shadowed a chiropractor. I could shadow a chiropractor in like our college town, so he was great. He showed me this other side of chiropractic. Like it's not only an adjustment; it's how you can integrate like physical therapy, like mental therapy, and education first and foremost. Which you're a doctor, your first tool should be to teach your patient. So yeah, I saw that other side of chiropractic. It's like, wow, I can see myself doing this. So yeah,
So something good came out of that injury, I guess. It kind of gave you that passion to help other
uh
athletes not
huh,
go through what you went through. That's great, man.
hmm
So I kind of want to jump into to when you're an athlete or when you're a competitive athlete and we're talking about these people that train, well, you would know, you train twice a day, you have a strength and conditioning program, you kind of go through these camps in order to prepare yourself for tournaments. And I feel like there's an ignorance when it comes to adequate preparation. It's like go hard, go hard, go hard, go hard, go hard, because you're going to need that when you go to compete. And I think that that's a very big misunderstanding when it comes to athletes. Could you kind of tell me, one, if I'm wrong, or two, what should be the approach? How should you deal with that type of stuff to train hard but evade injury?
you're 100% right. And I think mainly compared to other sports, martial arts and combat sports, like we're our own worst enemies. It's not only about working hard, but it's about working smart. It's on one,
Hmm.
it's both. You should be smart enough to know when to work hard and when to pull back. A phrase I like a
Hmm.
lot is from Tim Gavin. It's not the load that breaks you down, it's what your body's not prepared for. Many most injuries occur when the demand placed on our body surpasses its capacity. So how do you, for the most part, reduce the risk of injury? Training smart, preparing your body to handle that load, and auto-regulating. For example, like, you just slept like shit, didn't eat much, or had pretty bad diet, had been last stressful days. Pull back a little bit. Like this one single session won't take you to the next level, but it can drop you down several levels if you go too hard, too fast, too soon. So
Right,
yeah,
right. Do you think it's harder for athletes because I guess there's a mental game as well when
mm,
it comes to training. Like if they feel like they missed the session, mentally they're like, oh, I missed the session, I didn't train hard, I didn't feel it. So it's how do you balance that as a coach? Like you have athletes, you deal with athletes on a daily basis. How do you kind of, I guess the word isn't monitor. How do you analyze your athlete in order to understand what he needs in order to move forward and
mm,
be at the
I'm
best that he can be?
I'm laughing because that's something I struggle myself with. The best I would say the best was monitoring how you're feeling, like how was your sleep? Like, for example, I went to this strength conditioning session. How are you feeling? Like, how's fatigue wise, sleep wise, soreness, and general energy levels? Based on that, like you auto regulate, like meaning like suppose like it's gonna be a heavy day, but your recovery wasn't that good. You can pull
Hmm.
down a little bit. I feel also say keeping track of your recovery and your performance. If it's strength conditioning, like weights, reps, how did it feel? If it's rolling, like how hard, how intense were the rolls? How long were the rolls? How did it feel? So for
Right.
most we're keeping good track in history.
There's a sense of kind of honesty that you have
Mm-hmm,
to have with yourself when you're
mm-hmm,
training hard for a competition. But sometimes I think that an athlete would internalize that honesty as kind of not putting their best effort. You know what I mean? Because you have to push yourself in training, right? But if you're like, oh, I'm sore, I'm not going to train today, I'm not going to go roll, I'm not going to go to Taekwondo or whatever the case may be, like, I think that there's always that mental battle. It's like, I got to go because I have to get better. But man, it's impossible to kind of, it's not impossible, but it's hard to kind of balance that out, that honesty with yourself to be like, this is like, how do you, How do you know like when to be like, okay, I have to take a break, or be like, just push through this type of pain or this feeling of fatigue? Is there a way that you can kind of monitor that?
I would say I would be like, yeah, ideally if we have an initial examination, like have to perform with a medical provider who knows your history or your injury. For the
Okay,
most part, again, it all depends if you're talking about soreness, discomfort, pain, or if you're talking an
right,
injury. If it's an injury, it will depend on the site and severity. Like if, for example, blown out knee, yeah, for the most part, you should not be rolling. But if you like
right,
some
right.
minor knickknacks, like a little bit of pain on the shoulder, for example, it bothers you for the first like couple of days. Afterwards, it's get better. You can still roll and like do drills, strength condition, like just being able to know when you have to pull back and like up the ante.
So you definitely need to have somebody that's kind of monitoring outside yourself in order to get the best product, from what I'm hearing, right? The best kind of performance out of yourself, because
Hmm.
man, you need some. If you're doing it yourself and you're trying to monitor yourself, you may trick yourself into being like, I'm not injured, I'm just hurt a little bit, and you go into training. So it's better to have somebody that's tracking your performance like you do, right?
Yeah, 100%. Like we're super subjective when it comes to ourselves. Like, no, it's nothing. I can go with it, or yeah, it's something big. So like, it's good to have somebody more objective and keep you accountable. Like, hey, no, you have an injury. You cannot do this. Or no, you're okay. Like, you're just a little bit sore. You can go and just drill flow roll for the most part.
Yeah,
Which I know sometimes those flow rolls turns into dead
yeah,
matches, but
dude, you know your shit. But have you trained before or no?
yeah, I've done jiu-jitsu for the past 3 years. So I don't
Ah,
know
so you
because
you
yeah,
you know jiu-jitsu.
yeah.
I'm like, this guy kind of is throwing in the words that we use here.
But
Like he knows what we're talking about.
but yeah, I've been doing jiu-jitsu for the past 3 years. I started in Dallas for
Oh, nice.
chiropractic school, moved to Raleigh, was there for like 2 years and a half, then came back to
Right.
the island, started on the West Coast. Now we're gonna move back to the Metro. So we're gonna find
Oh,
another
nice.
gym over there.
Well, that's nice, dude. So you've been doing it with Cobrinha, right?
Yeah,
With Wilo?
I sometimes go over there. I started in Rincon Jiu-Jitsu and I moved to
Okay.
Isabela, which is closer to Aguadilla. So yeah, I sometimes drop over there, but yeah.
That's good, man. That's good. So you kind of understand the wears and tears of the sport of jiu-jitsu, of grappling. So
Yes.
let's kind of jump into, once you have that injury, once you get
Hmm.
injured, once you've surpassed that limit in your body, you get an injury, you have something coming up. What do you think is something as an athlete they should do in order to return to the mat as quickly and as productively, or as safely as possible?
Yeah. Again, it depends on the type of injury and the severity. So
Right.
ideally, first of all, you get assessed. If it's something big that's hindering your performance, you get it assessed by a professional, who ideally knows your sport. Based on that, for the most part, rehab, it's the same as training. It's just the caveat with the presence of injury or pain. But for the
Mm,
most part, at initial stages, yes, rehab is going to look more like PT, traditional PT, like bands, weights, like body weight exercise. But as we progress and your teach you heals for the most part, it should look like training. Again, granted, nothing will prepare you for jiu-jitsu like doing actual jiu-jitsu, but you
right.
can work on those capabilities and movements, for example, which ideally is going to transfer to the sport and prepare you a little bit better.
Dude, that's such a good way to put it. So such a good way to say, like, rehab is training, essentially. You
Yes,
know what I mean? Because I've never thought about it that way. Like rehab is kind of like, let me get better so I can get to training. Rehab is essentially training. That's just with an injury present.
exactly. It depends. Like you have injury or pain, like you might be leaning a little bit more towards the rehab side. Whereas you progress and like teach you also you feel better. Yeah, you're gonna be like harder, more intense. You want to mimic your sport a little bit more.
So what's your thought on surgeries? Sorry, I just came out of nowhere, but I'm just curious. What's your thought on surgeries and for getting better and kind of when an athlete gets injured?
Like
I
everything
know
they
it's very
have,
general.
like everything they have a time and place. And again, it all depends on the injury and like what symptoms are you having. For the most part,
Right.
research have shown if it's for pain, again, it's always a patient decision. But for pain, like we just have shown it's not that fructiferous or productive for the most part. So if it's for pure pain, like just in certain cases, surgery might be advised. Otherwise, you're better off doing conservative treatment like rehab, like PT, more like strength and conditioning for the most part.
Right.
If it's for like, for example, you blow your knee out and like you have some instability, your knee goes like
Right.
gives away, you have like major restrictions and all that. Yeah, there might be more value in those cases for surgery.
Yeah, like I've always heard the table, and especially like the kind of expression that when it comes to athletes and getting better or they have an injury, like you should evade surgery as much as possible and kind of use rehab first. Obviously, depending on the injury, like if you have
Mm-hmm.
you tore an ACL, or something that's extreme, that's not repairable through rehab. If it's something that just got torn, you tore your shoulder.
Mm-hmm.
I'm assuming, not being a doctor, that you would have to go in for surgery for that because you tore a ligament. That's something that's completely broken off. Or you're going to need that for the long run. But anything that's invasive should be evaded as much as possible when it comes to rehabilitation or when it comes to athletic performance. It may
Mm-hmm.
cause more damage going into unnecessary surgery than actually just rehabbing and taking the months off.
Exactly. And I think some studies show that's why surgery is so useful because you actually took time off your sport and actually did rehab, forces you to do rehab. So
Mm,
some of the outcomes you get from surgery are from the rehab and time you took off, not so much from the surgery per se. Yes, there's certain
oh,
cases like when mentioned, like from
yeah,
knee
right.
gives away instability. Yes. But otherwise, you're better off, like you said, start non-invasive. Like, hey, like I'm injured my shoulder. Let's try to do rehab. Let's try and do the least invasive first. And if that doesn't work, you can go up the ladder with something more invasive. But you didn't
That's
start from
such
most invasive to least.
that's such a good point that you just said, man. I didn't even think about it that way. Like, yeah, when you have surgery, you're gonna have to go through rehab anyway. So why not start with the rehab first and see if it works out instead of doing the invasive
Mm-hmm.
part first? Yes, and just to clear everybody out, I'm not saying that surgery is bad. I don't think you're saying that
Yeah.
either.
Yeah.
We're just
No.
having a conversation about surgery and rehab and the combination of the two elements. But it's such a good point that you just made that there is, like, let's say we take the surgery out, right? For a specific, there's also that component of rehab that you need to do and take that time off the sport. And like you just said, rehab is kind of like training. So it's probably better to start off, obviously, if a doctor says it and it's not something that's major, right? And there's always cases to start with the rehab. Take that time off from doing the direct training methodology that you were using beforehand and allow yourself to train through the rehab prior to going under the knife. And if you need it, then you need it. But at least you're giving your body that chance to recover itself. Does rehab, this might be a dumb question. I'm not a doctor. I apologize. But does rehab, like when you get injured and you have rehab and you start to take rehab, it's strengthening how does it take out the injury component by strengthening the muscles around it? Like let's say I have a bad shoulder, right? My rotator thing, I can't do that very well, whatever. But what are you really working on when it comes to rehabilitation? Are you working on the muscle that's injured or the muscles around it? How does that work? Like, how do you know what to work on?
It depends on the stage. For the most part,
Okay.
yes. If you don't use it, you lose it. So for the most part, you want to create changes. You create changes through adaptation and exercise. So yeah, for example, if you tore or injured your rotator cuff, yes, you want to stretch and stress the rotator cuff muscles. So you create that
Mm,
adaptation and that change. But also, you don't want to neglect the whole musculature and the internal rotators, external rotators, and even deltoids, or just the whole 360 or whole around joint. So more early
right.
stages, I'm going to focus more on the injured side. I'm getting that
Okay.
mobility, endurance, and strength back, and even power expression. And as we
Right.
progress, I'm going to start looking further down the kinetic chain. For example, if it's a shoulder, I'm going to start watching the thoracic spine because we know that
Mm,
the rib cage and thoracic spine is going to affect the shoulder mobility. Start looking at the
right.
neck, start looking further down and stretching other sides of the painful area.
Right. So yeah, so I'm kind of thinking about it in strength terms, and there's obviously
Mm-hmm.
more that goes into it. Like it's the flexibility, like you were saying. There's a bunch of other elements that go into the actual. Would the word be used? Repair the muscle? Is that like
Repair.
reparation would be the word?
I term it like a little bit better. It's exposure. You want to expose the muscle or your structure
Okay.
or tissues for the most part to that stress. Granted, it's graded and progressive. You start
Okay.
slow, you start low and slow, and as you get better, you start progressing a little bit more.
Right. So, and it's such a good point that you bring up that it's not just the injured muscle or the injured area, so to speak, that you need to focus on because when you get injured, you stop using other parts of your, I'm assuming, right? You start using
Hmm.
other parts of your muscle because of the pain that you have with that injury. And maybe there's deterioration on other muscles that are linked to that one that you're using there, which I can assume may cause injury in other areas, right?
And you start compensating. So exactly,
Right.
you want to look further down the kinetic chain, like just treat the body as a whole. Yes, you may have an injured shoulder, tweaked shoulder, but your body function as a whole. And getting, for the most part, jiu-jitsu is big on mobility. Pull
Mm,
like a lot's mobility, it's flexibility times strength. A lot of people see mobility as
Mm,
something passive, like somebody can move my shoulder like this, but
right,
you actually have the strength to get into that position and also importantly, get out of it. So also being like targeting mobility because mobility demands for jiu-jitsu are obviously going to be quite higher than general
right,
population. I don't care for the most
right.
part. Most people don't care about their shoulder over here or external rotation or internal. But if you're jiu-jitsu, yes, the Pony Americana or Kimura, you want to be able to have the strength to go through that range of motion.
So that's why it's so important to kind of the person that whoever you're doing rehab with understand the sports that you're doing. So there's got
Hmm.
to be an element from the professional that you inquire or the professional that you hire in order to do rehab with. They have to have a really good understanding of what's demanding of your sport. Because if not, you're
Exactly.
just kind of you're not really doing anything, right? Like if they're just throwing you through the mill.
They're just trying through the middle, and the goals you're going to get out of it for most part, the outcomes are going to be general, because they don't know the demands of the sports, like you mentioned. So they want to keep you baseline.
So how do you do that? Like how do you ever get do you ever get athletes from other sports than
Yeah.
the ones that you know? So
Uh,
what's the first step there then?
so most of the other ones I get a lot is basketball. Uh,
Mm,
just study, watch the sports. Like for the most part, I'm a chiropractor, also strength coach, like I mentioned. For the most part, we're pretty knowledgeable in human movement. It's the
mm,
same movement patterns, just different constraints. For example, squat, it's knee flexion, bending of the knee. For basketball, you have to do that movement pattern. It might be a little bit like shallower, not as deep as a like level change when you're doing jiu-jitsu, but a squat still a squat. Just assessing how they're moving, assessing their preparedness for that tissue, area, or loads. So studying the human movement and studying the sport and the constraint of the sports.
it's interesting, man. So you have to there's this research component to anybody that's coming in that you're not really, let's say, an expert in the sport or you haven't participated in the sport. There's always that research component of it before you can take the client and
Hmm.
give them what they need in order to move forward. So what can you walk me through what a process is when you get a new client? Like let's take me as an example. I have a shoulder injury. What does that process look like for you?
First of all, a history. 92 something, 80 to 90% of the diagnosis comes from the history. Just getting to know who Enrique is. What are you struggling with? What's your injury? What's your past? What have you tried? What hasn't worked? What has worked? So first of all, history, getting to know you, your injury, getting to know you a little bit better and who you are as a human being. Like, because you're not only like, that's something going on a tangent.
Go ahead.
You're a human being who's suffering from an injury. You're not only that injury, you're way more. So knowing all that context and baggage that comes with it, just getting to know you as a person, because first and foremost, you're a person, then you're an athlete. So a history.
And
And
what's
it's,
that? Go ahead. I'm sorry I
so
interrupted.
you're going to say,
So like so you take my background, you kind of look at the injured area, and then you develop a program in order for. I can imagine there's kind of stages to it, right? Like that's what I'm trying to get to. There's like you get
uh-huh.
to know me, but what's the next stage? What does it look like? What does that next stage look like after you get to know me?
So after the history, physical exam, seeing like where you are and where you want to be, I'll be
Mm.
just assessing again, same body capabilities and all that. And the stages of rehab for the most part will be first and foremost, pain control. You're in here because you have pain and that pain's holding you back on the mats on your respective sport. So pain control and load reintroduction. I want to
So what
stress
does pain
that.
control look like? Sorry, I interrupted you again. So that pain control really kind of, which we'll jump back into what you're saying, but I kind of want to jump into that pain control. What does that mean? Like what do you do for pain control? Depending on the
It,
injury, right? It's what is
uh,
it? Just a general overview.
for the most part, manual therapy are more like hands-on. You can do it hands-on with either chiropractic, manual therapy, like cupping. It's pretty big.
Okay,
ISM, which is like blade or scraping. I don't know if you've seen it. Any
I've seen it. I hear it's really
exercise.
painful. Is that true?
It is. It should not. Again, it goes back to the why behind the what. If it's through
Okay.
pain, it shouldn't. I don't say it should not be painful, but for the most part, it should not be painful.
It should be comfortable, right? Is that what you mean?
Yeah, it should not be uncomfortable for the most part. Again,
Okay.
depends on the why you're doing it. Other people do it like loosen up like soft tissues and muscles. By
Hmm.
research, we know we don't do that, or at least that way. So it's
Okay.
all that's needed. A little bit of pressure and it helps with pain. That's all it's needed. I don't need to keep poking and like making it worse than it's actually needed.
Do you think that's a big issue though? Do you think that that's something that a lot of people are doing? If it causes in your industry, do you see that that's a common mistake that a lot of professionals are making? That it's like a painful recovery when it doesn't need to be.
Yeah, okay. It depends on like this is my expertise, like the teaching massage or things like that, or
Okay.
sports massage. Other people have the expectations that in order for you to be useful or productive, it has to be painful.
Right.
Again, it depends on the why behind the what. Depends why you're doing it. So for the most part, yes, it's a common mistake I actually see, which is counterintuitively, because a lot of people like assume like mental therapy or hands-on treatment needs to be painful for it to be productive. But somehow if you
Right.
exercise with pain, it's counterproductive. So it
Right.
doesn't make
Yeah.
sense. So yeah,
That's good. So pain control. That's the first step. Where are we going
yeah.
after that?
After pain control, like even with pain control, load reintroduction. Again, like you said,
Okay.
you're
What
injured. You have not used that area for a long time. So just stress in that area. If it's just a little bit of range of motion, just getting the area or the joint or teachers moving, just getting them introducing the load through them.
do you give them like recovery? How does recovery come? Like I'm assuming that if you're introducing exercise to an injured area, there's got to be a component of recovering after the session, right? Is there a component of that when you do this?
Yes, for the most part in the early stages, not so much because the stress when we place it on the body or the structure is going to be lower. But again, yes,
Mm.
with higher stress comes higher demands for recoveries. So there's a trade-off. So in the early stages, I'm going to say not that concerned with recovery. For most of you have already recovered much. So it's when you start adding more to that bucket and demanding more. That's when you need to prioritize recovery or
Is that
even
like a
more.
testing period before, like when you start that loading phase or introducing? I'm assuming there's like a testing period to kind of see how much that muscle works before you can add more weight or more resistance to it, right?
100%. Again, it all depends on the type of injury. Some injuries, yes, you're going to be more nitpicky. For example, ACL, you want to actually measure
Mm.
how much poundage your strength of leg is producing, in this case, extension, which is mainly quadriceps muscle. Yes, in those cases, you're going to be a bit more nitpicky.
Okay.
But for the most part, otherwise, I don't say I don't care that much, but can you handle the load right now? Because technically every exercise is a test. If I put like 20 pounds over here and it's too much, let's go to 15. Is it better? Do you feel better? Do you don't have as much pain? Yeah. Okay. Let's keep you there, or let's start you there and like progress slowly.
So yeah, you kind of get a base, and then you kind of build from that base in order to get the recovery in the place that it needs to be. So
Exactly.
you do that for a while. I imagine you start increasing the load
Mm-hmm.
on a very general level, and then you get to where that person wants to get. I have very, and you trained before. What do you think are the common mistakes that us as athletes or us that train jiu-jitsu we do, and we just keep doing it? We keep bumping our head against the wall, and we don't see that we're making this mistake.
I was in first and foremost, which is my bias, neglecting strength and conditioning. A lot of people just see weights like, oh no, I'm like, I don't need to do weights. Like, I don't need that. No, you need to do weights. Research, like we have known this for years, and researchers have shown it. Like there was a study, I think 2014, Morrison et al. Like strength training reduces risk of injury by 60% compared to other
Ooh,
interventions. So
yeah,
if I have just one intervention like strength train, it's gonna
yeah,
lower the risk of injuries per time.
yeah. Dude, that's such a good point because a lot of jiu-jitsu guys just like to get on the mat and roll all day.
That's why
This is
nobody
what they.
wants to roll with a D1 wrestler. Like that's what they were like. Yeah, I'm pulling guard.
Yeah, but it's true, man. It's true. There's that strength and conditioning is neglected. Like maybe
Mm-hmm.
maybe people don't find it as fun or they just want to get better technically. But if you're competing or you want to compete at the highest level, you got to introduce that strength and conditioning. And do you think there's mistakes that when they do start doing strength and conditioning that they make?
Yes. Most of us want to run before we can walk. Just keep
Okay,
it simple. If you haven't done any strength training, anything is going to be a stimulus. So anything
right,
that you do, it's going to help as long as you're being smart or like diligent with it. So again,
right.
going back to the movement patterns, you have a roughly 5 to 6 general movement patterns. You have like a push in the horizontal and vertical pattern. You have pull,
Mm,
horizontal, vertical pattern. Squat or knee dominant, squat or knee flexion, hip hinge, which is a deadlift or a variation of deadlifts, and core, either rotation or anti-rotation or stability. For the most part, like
mm,
carries, suitcase, just hitting exercise of each of those buckets twice a week, twice to
mm.
3 times a week with a load that's challenging, not too light that's gonna bore you, not too heavy that's gonna frustrate you, or which is also gonna increase the risk of injury. So just keeping
That
it simple.
interesting. So you had those, I think it was 4 buckets that you mentioned right now. So it was
Yeah, movement patterns.
movement patterns. Sorry. So you
Yes.
have like 4 different movement patterns that are kind of the basis of what you need to focus on if you're an athlete, or is that for jiu-jitsu specifically?
Just even for like as a whole, like that's the most movements that happen in most sports. Kind of if you look at
Yeah,
basketball, you're like pushing over here, like you're pushing someone off. You're doing a squat, you're hinging from the hips. With jiu-jitsu, you're hinging from the hips when you're doing like bridge. You're getting someone up from your hips. Level change, you're doing like split squat or like squatting one leg. Frames, you're doing almost a push, horizontal push. Uh,
right,
Pulling. When you're pulling up, it's like you're doing arm drag. You're pulling someone
right.
towards you. So for the most part, just hitting those movement patterns, and you can specialize a little bit more tailored there, more towards the
Yeah.
constraints of the sport.
What were those movement patterns again? I'm sorry. It was push pull, right? Those are 2.
Yeah, push,
Squat,
pull,
right?
squat, hip hinge, and core or carries.
Hip pinch. What does that mean?
Deadlift, basically a abrasion
Oh, okay.
deadlift, like you're hinging or bending from the hips, hip flexion.
Oh, okay. Cool, cool, cool. That's good to know, man. Like I'm one of those guys that do the 80s workouts. You know what I mean? Has really nothing to do with jujitsu, but I never really dived into to strength and conditioning. But now that you mentioned that, that makes a lot more sense than what I'm doing right now.
You just keep it simple, big compound movements, biggest bang for your buck. I also I don't love weights. I don't say I hate them,
Yeah,
but also I don't love them. If I can be
right,
rolling, I'd rather be rolling than doing weights. But I know
right.
their value, and on the long run, they're gonna help me over here in the mats. So why would I neglect that component? So keep it simple and have fun with it.
Not just the mats, man. I think for life too. Like if you're
Uh-huh.
not lifting weights, it's your longevity is and your ability to use your body. Maybe not for jujitsu. Maybe you're not able to use it for
Uh-huh.
jujitsu when you get to your 70s. But man, you still want to walk and be able
Uh-huh.
to live a healthy life as long as you can. And we only get one body, man, and nobody's really paying attention to like. And we need to do it now if we want it for later. You
Uh-huh.
know what I mean? So that's pretty cool that you mentioned that those 5. Because now I'm gonna switch the way I do things. I'm gonna do very general stuff. I'm definitely gonna switch the way I do things. And I think it's really important that people know that the importance of functional strength training for jiu-jitsu to get better, but also for our life. You know what I mean? A
Uh-huh.
lot of people just that aren't athletes aren't working out the way that they should just for longevity.
That's the saddest part of all. I think 50% of Americans aren't meeting like CDC and WHO
Hmm.
guidelines for physical activity, which is 150 minutes of like aerobic training and 2 to 3 times of strength training. If I recall correctly, it was more than like almost 50% of people aren't meeting those guidelines.
Yeah, dude, I bet it's more than that.
Probably.
I'm willing to bet it's more than 50% just
Mm-hmm.
based off the people that you meet. And I think it starts when we're young. You know, it's not something that's established in our lifestyle
Mm-hmm.
that you're not giving importance to. You know, we get importance to do well in school. Mental health is very important, which is also very important, of course. But I don't think that people, or at least in our culture, in Puerto Rico, Latin culture, and
Huh?
in the United States, it's not something that's given importance to. You know, they give us PE, but PE is like what? It's not really taking care of your body, at least.
And I think that's the worst part. Like people see exercise and something you do for body. Oh, I don't need to exercise. I don't need muscle. Somebody you
Right.
should actually look. It's Dr. Gabriel Lyon. She has a quote
Mm.
like muscle. You should see muscle as an organ, which is actually is
Mm.
because not only for like longevity, for health span, regulates blood pressure better, blood sugar, prevents or not prevents, but diminishes the risk of cancer. And all these other benefits, not only, like you said, not only for sports, but also for life and health. Like
Hmm.
most people, oh, I don't need to work out. Like I don't want big muscles. Like, okay, you don't want big muscles, but they're gonna help you big time. So
Yeah,
yeah.
dude, 100%. Like there's people that, nothing wrong with this, but there's people that are like, oh, I eat well, which is great, man. You know, I have a
Hmm.
really good diet. I can eat well. That's awesome. That's awesome. But the reality is that if you're not, if you don't use it, you lose it. You know what I mean? Our bone density
Hmm.
drops when we don't lift weights and we're not lifting weights.
Hmm.
And as we get older,
Hmm.
we need that bone density in order to function. And it's been neglected. If you neglect it since you're a kid, you know, it's harder to pick it back up at an older age. And then you see these people come into rehabilitation or take their health seriously when it's already kind of too late. You know, you really can't push forward after that.
That's the biggest thing right now. Like the thing, we don't value stuff until we'll lose the ability
Hmm.
to get up and down from the floor. to push stuff. So just move your body weight. Stuff like that, we take it for granted so much. Something like, for example, sprints. I don't recall this statistic right now, but a lot of people, like older population, don't sprint or run or no jump nor jump. Like, we're
Mm-hmm.
losing that ability to develop express power.
Right.
That only, like, even strengthening, you can get even more nitpicky with power, like just being explosive. A lot of people don't also train that since perhaps high school or like God knows when.
Yeah, there was a study that I want to know if it's a study. I saw this video that there was this doctor that was talking about brain growth, and as you mentioned, sprints helps with you're a doctor. Maybe you can you can correct what I'm saying, but it helps with like neural cellular growth, I think, or it has to do with something with the brain. I don't know if it's neurocellular growth or helps with the cells in the brain and their health, right? So it was three things. It was sprinting, fasting, and cold plunging are like three things that can really help with mental health. And that's crazy because nobody thinks that physical activity is what's going to help your brain continue to function at the level that you want it to function at. You know, I didn't think that. I didn't know about
Hmm.
that until I saw it and I looked it up, researched it a little bit, and that was crazy how those two are connected to one another. Sprinting, I hate sprinting, bro. I really don't like it. You know, I'll start sprinting now that I know that it has a mental component to it.
It's a full body exercise. And like you said, also like exercise not only changes the body or like muscle, bones, it also changes the brain. Like you said, like there's something called neuroplasticity. Your
Mm,
brain's plastic. It changes with the stimulus you provide. There's something called also epigenetics. Your genes or the expression of those genes change or express themselves based on your environment. So if you
mm,
exercise, you may have predisposition to develop diabetes, but if you
mm.
eat a little bit better, do exercise, take care of your body, you lower that risk of expression. Doesn't mean you won't get it, but there's lower
Right.
likelihood if you don't do anything.
Right, the expression of your gene that makes sense to me. That make like you're a product of your environment to
Mm-hmm.
we're all products of our environment. So if you're living in a healthy environment that includes this physical exercise and includes this healthy lifestyle, then the expression of those negative genes, not saying that you won't get it, right? But they just won't be the risk will be a lot lower,
Uh,
right?
I don't remember what I said, but it was like meme. Oh, my like diabetes runs in my family. No,
Mm,
you have diabetes because nobody runs in your family.
that's such a good point. It's funny how the way you put it, but
Mm-hmm.
that's true. You know what I mean? You're not taking
Mm-hmm.
your health seriously, and especially in the Latin culture. I'm from Puerto Rico, like
Uh,
as well. Dude, like over there, we're partying, we're drinking, which is like we're very social animals, very nice people. We hang out, we all that stuff. At least I don't know if you've lived in Raleigh or you lived in the United States or you lived in other areas. Other places take health a lot more serious than we do, or at least Puerto Rico does. And I think that's a problem. In the
big
Hispanic
time.
community, I'm not just saying Puerto Rico, but Hispanics
Mm-hmm.
como tal, we
Uh-huh.
a lot of us neglect healthy activities, but we're there for the party.
We would miss that.
Yeah, we're not missing the
And,
party. We might miss a workout or two, but definitely gonna go party.
and
And I wish
that's
that people could just look
yeah.
into the future and see that.
And yeah, like we said, like most people don't see that until it's too late. I like have
Hmm.
witnesses with my family members and even some patients like, hey, I want to like do my best to help you, but at this point, perhaps you're so far gone, which you always try
Damn,
your best, but yeah, it's like, it's sad
of
to
course.
see.
Damn, that's so
Hmm.
like you don't want to get to that point that it's too far gone. And like I can help you feel comfortable. Like I can't help you, take this walker away or whatever. Because there might be other different causes for the walker, but let's just say in this example,
Hmm.
you know, I'm not gonna be able to take this away from you because you neglected it in your 20s and your 30s and your 40s, and now
Hmm.
50s you're starting to feel a little different. You
You
know,
won't be able to undo like decades of doing nothing with what, 5 years at most?
dude, it's not just doing nothing. It's like the way that they eat. You know, the drinking
Hmm.
habits, the eating. Like it's not you're not just not doing nothing. You're doing detriment to the way that you're living your life doing that way.
And not
You're
even that,
speeding it
like
up.
exactly. Like the pillars of health will be like sleep, how much or like not only quantity, but quality of sleep, diet, stress, and exercise. Those four factors, like they're the biggest predisposers or things that affect your health for the most part. So, and
Yeah,
within Puerto Rican culture, we do a relatively good job of stress. We do a terrible job with diet and exercise.
yeah.
And even
That's true.
sleep. We do a terrible job with sleep.
We do a relatively good job with stress.
That's
That is
good
so
side.
true. We're fun people. It's gonna be a great time. There's not gonna be any stress, but you're not sleeping. We're gonna get bullshit, and we're
Diabetic
not
and
working out. Don't worry about it.
diabetic and obese. We're having fun.
Right. That's so good, man. That's so true. All right. Let me jump into to that was a great conversation, man. I agree with everything you just said. But let's talk about optimizing performance
Mm.
while minimizing wear and tear. Right. So I'm gonna let you take the wheel of that. Like, what do you think about that statement?
Good way, like, it depends on how we define wear and tear, but a good way I like to see of or optimizing for performance will be like a pyramid. On the bottom,
Mm,
we have training, like managed stress management, both physical and mental. Like it all adds to the same bucket. Your body does not distinguish between physical and mental stress. Stress.
oh,
So
really?
first and
That's
foremost,
interesting.
managing stress. Second, sleep. Having a good, consistent, quality sleep patterns. It's going to
Yeah.
be pretty important. I don't remember how much, but sleeping I think it was less than 8 hours. I remember it was 20 or 40 increases the risk of injury substantially.
Wait, how
So
much was it? Less than 8 hours, you said?
I think it was less than an hour. I don't want to quote anything wrong, but big picture, not good sleeping patterns are going to increase the risk of injury.
Mm,
Um, like I said, stress management, sleep, diet will be another one. Like eating healthy. When you're injured, you should prioritize like not only like eating quality food, but also macros like carbs, protein, fats.
yeah.
Um, and fats like the other stuff like meal therapy. Like I love them, but for example, compression boots, cold tubs, and all that. Like those are the top of the pyramid. Honestly, don't do that, but don't pull all your eggs in that basket.
Oh, I see what you're saying. So like it's first is stress management, right? Is that what you're saying? Like
Yes,
if we're looking at the pyramid, stress management, and you said that your body doesn't recognize the difference between mental and
and physical.
physical stress. That's
Yeah,
interesting.
and it goes down to the same bucket. That's what like
Mm,
we have seen when people are in stressful times. For example, like students, NCs and college athletes, when they have
mm,
had stressful times, high risk of injuries because like you're handling all the like you're pulling from different directions. So
mm.
it's all out to the same bucket.
Do you know why that is? Like what exactly in stress makes you more predestined to injury?
hmm I'll be lying. Within the same thing with the sleep one, what we think right now is cognition. You're like, again, you're not fully in there. You're just like,
That makes sense.
you're mental, you're physical here, but you're mental, like thinking about the test, thinking about the exam, what a rough week you
Yeah, yeah, I
are.
get you.
What about this? So,
Yeah, you're
yeah.
not 100% focused on which leaves your defenses aren't up when you're in training and you do a
hmm
stupid movement, you get caught because you're stressing about some other stuff. That makes sense. And then
hmm
sleep is a good one. Sleep, and you were saying quality over quantity, and I get that, man. Sometimes I'll try to sleep. I have babies, so when I sleep 8 hours is like quality sleep for 8 hours. That sounds amazing, but I don't get that. Yeah, sleep is important. Diet, it's diet and then recovery. You don't want right. Is that like kind of
Yeah.
a ranking system? Is that correct?
Yeah. And for the recovery, like either like there's more literature, more research for active recovery, like zone two, which
Active,
is
right?
roughly 60, 70% of your heart rate, just going for light walk, flow rolling, drilling, uh, uh, like lighter loads, nothing that creates too much fatigue, which again, you recover by doing less, not doing more. So
Right.
why we're gonna like stress your body and add a little bit more stress or physical load. So yeah.
And a lot of your recovery comes from sleep too. So it's like you're saying
hmm
active recovery. You know what I mean?
hmm
I guess like sleep is such an important part of your recovery. So it's there.
hmm
It's already there in the sleeping. You know what I mean? A lot of your recovery is done there. But extra recovery is always good. Yeah. You know what I mean?
hmm
Extra recovery is always good. So I kind of want to talk about what your focus on athletes. You're gonna go to Ario Metro, which for people that are listening is like San Juan, right? San Juan, Guaynabo, that area, right?
Yep. We literally
What are your
like, sorry, can
Go
I
ahead.
say?
Go ahead.
No, like really we're gonna move like next week, so like that's what's kind of like hectic all over the place. So yeah,
And you're moving from the other side of the island, which is
really,
a heck of a drive, bro.
yeah. I'm literally right now living in Isabela, so I'm gonna move to Atorrey. So yeah, like from west, like from coast to coast almost.
So what are your plans to moving over there?
open clinic. We're already like signed the lease and all that, so we're planning, hopefully, fingers crossed, opening in January. Depends on the permits and all that, but hopefully open in
Yeah, yeah,
January
yeah.
and just keep teaching and like keep training patients or clients online too.
So also doing online as well?
Yeah, for the most part I do training conditioning online, like
Oh,
through
that's
an app. I
smart.
send you the link and all that. So yeah, you have your own personalized program, 100%. So yeah, usually 2 to 3 days because for the most part 90% of them are jiu-jitsu or combat sports athletes. So yeah.
That's cool, man. I mean, combat sports is definitely an injury prone. I mean, it's good for business. You know what I mean?
Mm-hmm.
You don't want to see anybody injured, but at the same time, it's good for business, right? What are you gonna do? That's a good industry
So,
to be in, and to be focusing on that industry is great, man. It's a great
hmm
industry to jump into. So you have an application that you do programs for mostly jujitsu people and
yeah,
combat sport people. That's great.
yeah,
You have your hands full for sure, man. And you're opening
you
up
can
a
say.
clinic. You're also gonna keep teaching?
Yeah, I'm gonna be closer there. So yeah, I'm planning on keeping the teaching gig, which I like teaching for the most part. It improves your communication skills and like again,
Yeah.
as doctors, you should be able to teach your patients. Doctors come from the Latin docere, which is to teach. So my first and foremost intervention is to teach you what the F is going on in your body. How can you help? How can you optimize? Provide you tools to help you with that injury or condition you have. And I'm gonna be here as the guide. You're the hero. I'm like literally you're Luke. I'm Yoda. Over here in the
Yeah, I
backpack.
get it. I get it. That's a good way of putting it. Like it's also good. The teaching is also a good component as a doctor and as
Mm-hmm.
a kind of like a link to
Mm-hmm.
another activity that you're doing because it keeps you in the know. And then you
Mm-hmm.
have to explain that to other people. And by explaining it, you also kind of learn it better. If you can't explain something in simple terms, I probably won't believe you. You know, if I ask questions and you tell me something that's like all jargon written, I feel like you're regurgitating it. I'm not gonna believe you. But if you can break it down in simple terms that what I can understand it, I think that that means that you're more of an expert of what you're more knowledgeable of what you know. And I think teaching, especially when you're doing this type of work, if you're teaching as well, it keeps you into this constant research component that you have to be up to date with the information. And then you can apply that to your clients and to the athletes that you work with. So I think that's awesome that you do that. Not a lot of people do that, right? It's not a common thing.
Uh, in the island, there's quite a few right now because the college opened about I think was like 3 years, 4 years each ago. So yeah, like a lot of people are like getting into it right now. But yes, in grand scheme of things, it's not that common.
Yeah, it's not that common. So we got 10 minutes left, man. I kind of want to give you open space here to promote and to talk about anything that I didn't cover. I know we went on a tangent there talking about healthy living, healthy lifestyle. That was a great conversation, but I want to make sure that we get anything that it is that you want to cover and you want to talk about before we sign off.
Thank you. Uh, yeah, for the most part, like key things. Rehab is training the presence of injury. Like I didn't quote it's Phil Glasgow, the one who coined that phrase. Rehab should not look that different from training.
Mm,
Keep it simple. Think of movement patterns rather than muscles. Train movements, not so much muscles. By training movements, you will train muscles. But by training
mm,
muscles only, you're gonna move some movements. Doesn't mean don't do bicep curls, but again, biggest bang for your buck. Why would I spend like 30 minutes doing bicep curls when you can like do pull-in exercise, which also targets bicep, like vertical,
hmm.
horizontal pattern. And if you have some deficiency you want to work on, yeah, by all means, do bicep curls. 80%, 80-20. The 80% should come on this movement patterns. And that 20% should be like isolation or deficiency exercise. What else? I think that instead, but for in general, if you've heard Rice, that they don't do that anymore. It's peace and love. Protect, elevate, avoid anti-inflammatories, compress, and educate. And love, load, optimism, vascularization, and exercise. Peace and love for injuries, not so much rice.
What's rice?
Rest, ice, compress, and elevate.
Peace and love. Okay. I'm gonna
Yeah.
have to write that down. That was a lot, but thank God we have it recorded.
Yeah. From also like, it should not be, it's not rocket science. Keep it simple. Work with a provider that understands your body, gets to know you, who you are as a person, and understands your sport and the demands of your sports. Yeah. So most of that's gonna be it. If people want to know more, they can find me on Instagram, Movement Rehab Doc. Again, I mainly do strength conditioning, virtual strength conditioning for most of my clients, and some rehab virtual too. So for that one, it's a little bit more. We have to do first. I'll get an interview basically get to know
Right.
you a little bit better. You get to know me, see if we were a right fit, because I don't want anyone
Right.
to be like here forced. So same there. So mainly virtual strength conditioning, virtual rehab, or people want to see me in person, like they can soon contact me in Torrey, which is going to be hopefully in January. Follow the
Do you
movement
have a name?
clinic.
Do you have a name for the clinic? Movement
Yeah,
clinic. Sorry,
yeah,
I
it's going to be the
interrupted you
same
right when
as
you were saying it.
yeah, it's going to be exact same as we had in Aguada, because right now we already what we're doing is moving the clinic from Aguada to Torrey. So yeah,
Oh, nice. That's a good
yeah,
area.
yeah.
That's good, man. So if people want to reach you, the best way to do it is through Instagram. Is that
Yeah, the most
fair?
word movement rehab doc, Instagram, and like that's 99% of the time I spend is social media and Instagram. I don't use Facebook that much, but same movement rehab doc, X or formerly
Nobody uses
Twitter.
Facebook anymore.
Uh,
Facebook is not
old
something
people.
people use.
No.
Maybe
Uh,
it's great for you. Maybe you should stay on Facebook.
but I'm not of that age yet. But yeah,
Yeah. No, I'm saying like maybe you get more clients that way.
yeah, that's what I do. Like better to have it than and need it and not have it. So yeah,
100%, dude.
yeah.
100%. Yeah. And Facebook, I barely get on it, but yeah. So Instagram is where it's at. Oh man, this was great. This was great. I really learned a lot in this interview, in this episode. If you ever want to come back on, you have something you want to promote or anything like that, you're more than welcome to
Thank you, brother.
come. This is great, man. I appreciate your time.
Thank you
I'm
for
gonna.
having me here.
Oh, thank you. So Movement Doc is movement Movement
Yeah,
rehab
movement rehab
RI
doc.
or movement rehab doc. So rehab REHAB DOC. Put the ad side in front of that. Go to Instagram. Your friend. His name is José Torres. Thanks, man. Appreciate your
Thank you,
time.
brother.
I'm gonna stop the recording. Done.